this is 4,300 people who will now be completely, be covered. So they're not having to take that second shot. So now we can move them on and start with the next group, which is exciting. So it is a more rapid way to get more people covered and protected, which is awesome. We were very unsure exactly when it was going to come. And I kind of hedged my bets and thought we would get it in time for this Saturday. So a lot of people in the other regions were not exactly sure. They thought to plan for the next week. So I think you'll see it even out more per capita when we start getting more in. Now, we're not going to get more Johnson & Johnson until I think they said the 22nd of March is when the next shipment will come into the state. So I'm excited that we got this much and we can start really pushing it out. And we will probably do something continued on a Saturday. We want to be able to replicate this, and we've looked at, do we do it once a month? Do we do it twice a month? Do we do it every it would be hard when you talk about the number of people it takes to maintain, every week, 6 days a week as opposed to 5. But we are definitely looking at how can we continue this on a regular basis. Johnson & Johnson, they are 100% effective. So no one in the trials who took this shot was hospitalized with COVID or died from COVID. So they're 100% effective in preventing severe disease and preventing death. That's huge. That's really our biggest goal, right? We also know that when you only have a very mild case, your likelihood of transmitting it to other people is decreased. So your viral load is lower. So even though you may catch it, and we still were going to want you to wear a mask, you won't be as likely to transmit it to other people. It may be that Johnson & Johnson comes out later and says, we're going to do a booster on you. It may be the same with Moderna and Pfizer when we start looking at all of these variants that come along. The interesting thing about Johnson & Johnson is they tested in a time frame and in an area of the world where there were some of these variants, and they know that they are effective against some of the variants that are out there right now. So that's great. But you may see any, either all or none or any of these vaccines to come out and stay. We may need a booster. Just not sure yet, but it's a very effective vaccine, and it's going to protect you. And I would not hold off on being vaccinated simply because of that one number. It's really hard to have a feel on the community as to how many people who are in those open tiers are still wanting and needing to be vaccinated. We have done a really good job up here vaccinating large numbers. I think we've done a great job, but I hope that if there are people out there that want to be vaccinated, that can be vaccinated, that they'll come take advantage of this. We've gotten this down so well. Dr. Vanchery and his team, they are literally doing a shot a minute for every lane. So we're talking like 12 shots a minute that could go through that site. So it shouldn't be a delay, even talking about all the numbers that we could give. So I really hope that people will take advantage of it and leave me with not a single dose. I wish that we could say personal responsibility would be enough. We just don't find that to really be true. I don't think now is the time to take your foot off the gas. I really don't. I think we're doing great. And I think he's being very smart in taking it slow.